Hey guys, this is Dr. Janvi. Welcome back to the series of case-based scenario. In this video, we are going to see about PDL fibers from the subject periodontology. So, as you can see in this image, the principal group of fibers are divided into 5 groups. That is interradicular group, apical group, oblique group, horizontal group, and alveolar crest group. So, you can appreciate that from this uh, image also. So this is interradicular group of fibers, these are apical fibers, these are oblique group of fibers, these are horizontal group of fibers, and this is alveolar crest group of fibers. Okay. So the PDL consists of principal fibers. So these are the group of principal fiber groups: loose connective tissue, blast and clast cells, that is osteoblast and osteoclast cells, occipital fibers, and cell rests of Malleus. So the main principal group of fiber group is alveolo-dental ligament. Okay, so this is alveolo-dental ligament. Okay, so this is all as alveolo-dental ligament, which consists of 5 fiber subgroups as we have seen before on multi-rooted tooth. So the principal fibers other than this alveolo-dental ligament are called as transeptal fibers. Okay. So coming to the Sharp's fibers. So what is Sharp's fibers? So here in this image it is very clear, right? So these fibers, what these principal fibers help is they naturally substantially compressive force, withstand substantially compressive force during chewing and remain embedded in the bone. So the ends of the principal fibers that are within either cementum or alveolar bone are known as Sharp's fibers. These are Sharp's fibers are nothing but the ends of the principal fibers, that is either in the cementum or in the alveolar bone, are known as Sharp's fibers. Then coming to alveolar crest group. So this is alveolar crest group. As you can see this is alveolar crest group. So these run from the cervical part of the root to the alveolar bone. So as you can see here, they counterbalance the occlusal forces on the more apical fibers and resist lateral movements. Okay. Then coming to the horizontal group of fibers. So this is horizontal group. Okay. So they attach to the cementum, apical to the alveolar crest fibers, and run perpendicularly from root of the tooth to the alveolar bone. So root of the tooth to the alveolar bone. They resist lateral forces. So they resist lateral forces. Then oblique fibers. So this is oblique group of fibers. So as you can see, they run in an oblique direction. Okay, so they are most numerous fibers in the periodontal ligament. So this is an important one. The oblique fibers are the most numerous fibers. So they are running from the cementum in an oblique direction to insert into the bone coronally. Okay. Then these fibers resist vertical and also intrusive forces. So oblique fibers resist vertical as well as intrusive. Then coming to the apical fibers. So these are the apical fibers which are present in the apical end of the root. Okay, so these are found radiating from cementum around the apex of the tooth to the bone, forming the base of the socket or alveolus. So they radiate initial resistance to the tooth movement in an occlusal direction. So they radiate initial resistance to tooth movement in an occlusal direction. Okay, then interradicular group of fibers. So this is interradicular group of fibers which are present on the inner surface. Okay, so they are only found between roots of multi-rooted teeth such as premolars and molars. Interradicular fibers are found in premolars and molars alone. They extend from radicular cementum to the interradicular alveolar bone. Okay, so coming to a clinical scenario here. A patient reported with bleeding gums in lower posterior region. Posterior region includes premolars and molars. So clinical examination shows a deep pocket of 7 mm distal to 3/6. Distal to 3/6, it is showing deep pocket of 7 mm. While other areas show shallow pockets within clinical attachment loss in the range of 2 to 3 mm. Diagnosis is made as chronic periodontitis with trauma from occlusion in relation to 3/6. Which group of PDL fibers will get affected with respect to this? Okay, so with respect to this, that is first of all, it is a deep pocket. Okay, and while other areas are showing shallow pockets of clinical attachment loss. Okay, so shallow pocket with 2 to 3 mm. So as we have seen in the multi-rooted teeth, the first fibers that are present is alveolar crest fibers, right? So which group of PDL fibers will get affected with respect to this? So the most commonly affected group of fibers on all the sides of this tooth will be this, right? So even though a deep pocket is there on the distal region, if it was specifically as it is a 7 mm deep pocket in the posterior region, then based upon this based upon the tooth length, we could have calculated the fibers, which we can calculate the fibers which is at loss and this affected area. But on a whole, the affected area on a whole, like entire tooth, the affected area will be alveolar crest group of fibers. So answer will be alveolar crest group. Okay. So if you like our video, do subscribe to our YouTube channel. You can also find us on Instagram at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also find us on Telegram. Thank you.